This is our technologist area where they work. It's sort of the brains of the operation where they can view all the images on their computer screens, enter all the data, the demographics for the patients and all the studies that they're going to be having here. They can review the exams here before they come show us in our offices. So the hub of activity happens right here. This is our gown waiting area. The patient comes in here. There's a couple changing areas here with lockers so that they can get changed, and they wear a little wristband with their key on there. And then we have the waiting area here where they can have some coffee or tea, watch some television, and just relax here until their appointment time.
As much as you can relax.
Yes, it is a very tense place. But this, with the colors and the feel here, so much more relaxing.
It is.
To help take some of that tension away. Everybody's worried when they come here. You know, you don't want to be told you have cancer when you feel fine.
Right. I mean, you really don't.
Yeah, it's a scary time, and we realize that. So we've tried to make it as inviting as we can for our patients.
But having a place like this that's just so friendly and so warm, I think that again shows the care and the concern that you have for your patients.
Yeah, a lot of people put a lot of thought into creating an optimal center here for our patients.
Is there a relationship between breast calcifications and cancer?
Well, calcifications are one of the signs that we look for in certain breast cancers. A lot of them do develop calcifications. They're dystrophic calcifications, right. Basically. They show us that there's something abnormal going on in the area that is causing the secretions to be blocked and causing calcifications. There's a whole host of reasons for benign calcifications in the breast, and our job is to try to figure out which is which. And some are obviously cancer type, some are obviously benign, but then there's that gray zone in between that often ends up with a benign biopsy. But you know, it's hard to tell the difference in some of them, and they need to be sampled to see what's going on.
You know, I do know that people who have, friends of mine who say, oh, I have to go back, I have calcifications, and they're panic stricken. And I just thought maybe the public would like to know that that's not always a reason to panic. It's just something to check out.
Right. We need to make sure they're not changing in a way that shows that there really is something significant going on there, because there's a lot of benign calcifications. And we certainly don't want to put everyone through a biopsy for just benign changes.
What's different about mammography following a previous cancer, a lumpectomy, and how is mammography affected when you've lost a breast and for the other breast?
Well, we continue, of course, to screen the other breast because there is certain incidents of bilateral cancer. So we have to pay very close attention to the other breast. And the surgery breast, it can also be tricky because there's normal scar that develops in there. Right. So often we do ultrasound to look at the scar to make sure that it isn't blocking something on the mammogram. The digital mammogram is proving to be very helpful with these scars because it can penetrate some of that. So that has been helpful. But yeah, the post-surgical breast is a little bit more difficult. And it also gets calcifications, as we were talking about, but they're normal, they're part of healing. We just need to follow them to make sure that they are just benign.
I think it's good for people to know these things, you know, to at least hear it once, so that you're going to panic when you get called back anyway, but it's not always a panic situation.
Oh, that's right.
You know, this is just a continuation of your care to make sure that everything is okay.
Right, and you know, even when you do require a biopsy, only about a third are positive. So, you know, if you play the numbers, 2/3 are negative. So
I was really pleased to hear the guidelines on the news last night. Saying that they do support women in their 40s beginning mammograms and continuing to have them.
Oh, yes. You know, our pathologist did a wonderful review for us. After that task force issue came out at the end of last year, Matt Foster is one of our specialists in pathology and breast disease. And they keep the cancer registry, so he was able to access some numbers from the last 5 years here. In Lynchburg, there were 248 new cancers in the 40 to 49-year-old age group. And I think he said 160 of them were mammographically detected. So yeah, it's still really important to start at 40. And even younger if you have high risk. You know, if your mother was very young when she was diagnosed, we need to get them started in their 30s.
So your recommendation is to...
Haven't changed.
Just to keep doing what we're doing.
Right. And keep it up.
They had, Diane Sawyer last night had asked about the task force from last November. Were they likely to come out with a different statement? And she said, Sanjay Gupta is who she was talking to, and he said he doubted it, you know, because they're focused one way and this is something else. Yeah. Tell me, what future plans do you have for this facility?
Well, I talked a little bit about the tomosynthesis, so that's another thing digital might do for us. And there's breast-specific gamma imaging, one of the nuclear medicine tests that we're experimenting with. Looking into getting that. Some facilities are using that now. It's supposed to be a bit more specific than MRI. MRI is very sensitive, but not too specific in terms of it shows up a lot of benign disease too. This BSGI is supposed to be very specific to breast pathology. So we actually have a room reserved here, hoping to add BSGI really soon.
That's great.
Yes, we did reserve some space for that. And that of course, involves injection of a radionuclide, but it's sestamibi that targets breast disease. And there is now a biopsy procedure that you can add on to the machine, done like a stereotactic again, that we can biopsy something that we found. So that's probably the next step we're going to add.
That's wonderful. When do you expect that may?
I'm hoping in the next year.
I thank you so much for being a guest on my show.
Thanks for having me.
And for taking us on a tour of this beautiful facility. Letting people know in Lynchburg, what facilities are available to them. We no longer have to go out of town. We no longer have to go,
and got a full cancer care service here.
This, in combination with the Pearson Regional Cancer Center, I think is something extraordinary that Centra Health has brought to the city.
Yes, they really have. It's a wonderful circle of care.
Yeah, it is. Thank you so much.
You're very welcome. Thank you.
Appreciate it.
Thank you.
I hope you've enjoyed this show and found it informative and have enjoyed the tour of the new breast imaging center here at Virginia Baptist Hospital. My Halloween show is going to feature James Lair, who's owner of Collector's Lair, and he's going to be talking to us about comics and collectibles. You want to stay tuned for that. Hope you've enjoyed the show. Have a wonderful evening. Good night.